Doctors in Detroit say they performed the first ever double lung transplant due to vaping damage. The patient, just 17 years old. Nichelle Medina reports.
Doctors at Henry Ford Health System in Detroit say vaping damaged a 17-year-old's lungs so severely he needed a double lung transplant.
What I saw in his lungs is nothing that I've ever seen before, and I've been doing lung transplants for 20 years.
Doctors say the teenager is doing as well as can be expected. He is not being identified and is asked for privacy at this time. A family statement says, quote, "Within a very short period of time, our lives have been forever changed. He's gone from a typical life of a perfectly healthy 16-year-old athlete to waking up intubated and with 2 new lungs, facing a long and painful recovery process."
Within 2 weeks, he was off the ventilator and starting to work with our physical therapy team, starting to walk again and slowly regaining his strength.
The hospital released these images of the lungs before and after the transplant.
There was an enormous amount of inflammation and scarring, in addition to multiple spots of dead tissue.
So far, 2,051 people have been diagnosed with vaping-related lung illnesses. 39 have died. A recent study found 11% of middle school and 28% of high school students reported using e-cigarettes.
I believe we are just beginning to see the tip of the iceberg, and making sure that our teens understand the danger of vaping is of paramount importance.
The patient's family added if his story can save just one person and prevent others from vaping, it's a step in the right direction. Nichelle Medina, CBS News.
Well, last week, the CDC announced a potential breakthrough in the vaping outbreak. Investigators found the chemical vitamin E acetate in the lung fluid of nearly 30 patients who suffered lung injuries.